So, for your folks are doing what I call the pre-screening, call it that. How do you train them? What do they take to train them up to do that?
So they went through a series of training last Friday at Yakima, where they worked with some of our VP partners, and then there was some online training that they took, and some of them have also had the MACDIS training, but they went through prep mod training for part of that in case that was one of our options. Prep mod, it's just a registration platform, so our guys are ready to do whatever they need us to do at this site.
Well, we sure appreciate them from the nation's capital, our capital, Ridgefield. You're covering the whole country.
Roger, we're citizen soldiers, so that's we're here to serve our community.
It's just amazing how fast you can train people up for this duty. It's just amazing.
5 days ago, this team was doing COVID swabbing in another city.
Right. Well, I expect they'll be doing brain surgery next month, so.
They've already offered us the training for us.
I wasn't doing that training.
Well, you know, this is really slick to be in your car inside. Talk about deluxe service.
Yeah, it's been working out quite well.
Yeah.
It really is. So we've been able to have the vaccinators actually come to the car. And you'll see Andy right now is hopped into a vehicle.
Oh, there's Andy, yeah.
We'll be able to
there's
see
Andy.
him actually get his vaccination.
Don't give up, Andy.
I want to fight it.
Don't give up. What percentage of people are couples in the same car? Many people doing that?
I'm not really sure, but just anecdotally I've noticed that there have been a large chunk of them have been multiple people in the car. Right. Usually 2 or 3. I've seen a number of couples, or they'll bring a neighbor with them or a friend.
Yeah, remember Governor right now, so because we're doing, be careful, because we're doing 1A with the healthcare workers or 1B1 with seniors, sometimes seniors aren't going to be able to drive themselves, or if they come with a family member or it's 2 together, so we want to make sure that we're giving that opportunity. But the best thing is, because of the potential challenge of rain or snow or anything else, is that people stay in the car, they have their heater on, they have their windshield wipers on, they can keep going through, but the vaccination is happening right here under this. And if we were, the reality is, if we were in a situation, and you can correct me if I get this incorrect, but if we had a situation where we didn't have we're doing all the plans to have an enclosed space, but if we did not have that, we could simply use a tent system to be able to vaccinate in a way that's going to still allow the person to be under a cover, and then the person, our vaccinator, would be going to the window and then vaccinating. So we can be very
in the other 3 sites, is there a roof over the head? Challenges. Man, thank thank those members traveling.
Yes, sir, I will.
Yeah, it's a tremendous service to be able to get to everybody.
I will, sir.
Thank you.
Well, thank you. Thank their families, too.
I will, sir.
Yeah, that's right.
So are we going to watch...
Yes.
Yeah, let's...
Is Andy...
Oh, yeah, let's get the...
Is Andy
gets...
Has Andy got stuck yet? We're going to miss Andy there. Has Andy got stuck yet?
Mrs. Inslee's going to leave some cookies for people on the tables there. And if the rest of the group can kind of hang back a little bit here, We're gonna walk down to the end where the CRD is, and they're gonna administer the vaccination to Andy, who you just met with.
And the white one?
The green one with the tail lights on.
Okay, yeah.
So Mrs. Inslee, Rudy? We're just gonna walk down the aisle.
Decide whether they go to your store or they come to the site? You just give a choice, or how's it work?
Are you okay?
Specific link. For this event, we created a specific link.
A separate link?
Yes, and we have specific number of components that are So for this one, we created about 730 appointments a day. And then for stores, we have a separate. We go right to that store.
Yeah, that's fantastic.
And as it opens and we get federal doses, because we're a federal pharmacy, it'll be easier because then more doses will be open.
What is your sense, because we do plan on getting more doses, what's your sense? Umair Shah of the Department of Health, my wife Trudy. She's got a little cookie for you.
Thank you.
You deserve it.
Okay, here you go. Got a little springtime goodie for you. Thank you very much.
Now, are you one of the vaccinators?
Yes, I am, sir.
Yeah. What kind of training do you have to do this?
Well, when we go to AIT, like minor MA training as well as EMT training. So all of us learn how to give vaccines and how to do emergency medicine as well.
When you say we, is that like
Any medic.
Any medic? So
Any
you're a
medics. Yes, I am,
You're a
sir.
medic in the Guard.
Yes.
Got it. So how long have you been qualified to do vaccinations?
For about 2 years now, sir.
Good, great. Well, we're really impressed. They told us this is like
Thank you.
like 4 minutes of vaccination. That's really fast.
Well, we've been working really hard since Monday to try and get this all running a little bit smoother every single day. Every shift tries to get it a little bit better than the last shift.
What have you learned? So if we do another site, what lessons shall I share with them?
To try and delegate a little bit more, to not take on every single responsibility, try and make sure there's somebody that's scribing and getting all the information down and making sure the patient information isn't just everywhere, and somebody that's just really focusing on the vaccines themselves.
Yeah.
Hey.
Well, that's the way you do a big operation.
Let them work.
Thanks, Barbara.
Thank you so
Nice to
much.
meet you. Yes, thank you. Can you get this bicep? It looks like
Easy on the gun.
it looks like they got some real guns here. You got to get the thick needle on
really
this one.
deep on Andy if you don't mind.
Get the really deep. I'm Jay. What's your name?
My name is Hans.
Hans?
Yes.
Are you with Safeway?
I am with Safeway.
Yeah. Thanks for what you're doing here. It's great.
Oh yeah, absolutely. We really enjoy it. We're happy to be here and be a part of this.
Yeah. Well, we brought you the toughest bicep in the state here, so we want to see if you can do it.
All right, we'll see if this needle's sharp enough.
All right. You see if it's sharp enough.
Man, it's steel here.
Guns of steel right here.
Andy, we want to smile under that mask.
Yeah, where's that smile, Andy?
We want to smile under the mask. This is great.
If I pass out, just hold my eyes open. So
All right. Looks like a healthy guy right there already.
well done, sir. Well done.
Yeah. Didn't even feel it. You know what's amazing? Literally, I didn't feel it.
Yeah,
The needles now are so incredible.
they are. You know, a lot of times, as long as you can get the right technique and relaxing your shoulder, that's the biggest thing with it.
Yeah.
Just stay relaxed and it's pretty painless.
Yeah. Well, thanks.
I say do it. I got my vaccine as well from the Bible, and for 95% effective, so it's going to be a really good thing that my COVID
Yeah, I know that's. I don't know much worse than 95%.
Impressive.
It is huge. I mean, flu shots are a lot, like 70% at the best.
Yeah.
So this is a lot better.
That's great. Don't hesitate, vaccinate.
That's right.
I love it. I love it.
And
All right,
Governor and
sir.
Dr. Shah, we're going to have you
Yes.
talk to the media over here.
You got it. Get ready. Come over to the corner.
Governor and Dr. Shah are going to be here.
Right there.
On this side of it, yeah. Governor and Dr. Shah are going to be right here. Shah, it's going to be right here.
We get the We'll kind of spread out. We will do kind of a chevron. Rebecca, could you join us here?
Which way do you want us facing, sir?
We'll face the cameras. These are the dangerous guys here, so they're the threat.
They are.
Yeah. All ready? Well, listen, we've just had a tour of an amazing accomplishment at Ridgefield at the Fairgrounds. Within about a week, a combination of the Washington National Guard, Safeway, the Department of Health, the people who run the fairgrounds have put together an operation that's done over 700 vaccinations just each day in the last couple of days. And we just could not be more delighted about how functional this operation has been so quickly to bring so many vaccinations at such a critical period of time. The fact that we've had multiple organizations working together to stand this up is just a thrill to me, because every one of these vaccinations is potentially saving a life. That's like 700 lives a day under this barn that we could be saving because of the work these folks are doing, and I'm very appreciative of it. Now, the good news is there are 3 other sites that we've also stood up: Tri-Cities, Wenatchee, and Spokane. The Guard is at each one of those. The Guard is also doing a mobile clinic that did over 500 at Panorama City yesterday, so that we can get out to people who can't drive to one of these sites. We want to get everybody who wants a vaccination vaccinated. So I couldn't be more delighted. And what I have seen is that the production is they can do this almost 1 every 4 minutes, which to me is astoundingly quickly, because they've used the Guard to do the logistical work so the person is prepared when they get to the vaccinator. And they're getting better every day. So I just want to tell you how impressed I am by this, and I think it should encourage us, the progress we've made in the state of Washington in the last week. We've gone from about 13,000 vaccinations a day to almost 40,000 a day in the last few days, just in the last week to 10 days. So we are in the path to success, and I couldn't be more excited about it. Now, that doesn't mean all 7 million people can get vaccinated today in this barn. We have limited doses, and we are excited. We are excited.
Thank you.
See, buddy, you look healthy. Stay that way. All right. We are very excited. The president has announced the order for additional hundreds of millions of doses. We've obtained a 16% increase in our doses, essentially guaranteed for the next 3 weeks. And of course, having doses is ultimately the salvation of this. We want to get as many doses as fast as we possibly can. But we're showing success, and I'm very, very happy about it. We have Dr. Umair Shah of our Department of Health. Want to talk about this, Dr. Shah?
Sure. Thank you, Governor. Thank you, Major Hopkins with the Guard, and thank you. Just want to say thank you to you, our team, incredible team that's been here. This is just such an opportunity for us to really do so much. This is really, my name is Umair Shah. I'm the new Secretary of Health, just so in case you don't know. We are so grateful to all the partners here with Safeway, the Guard, and really even the host here with Mr. Morrison for allowing us to be here. As the governor mentioned, this is really an opportunity that we want to make sure that Washingtonians know that we're on it. We're doing everything we can, but we can only do it if we do it together. And so we've made an incredible amount of progress this last several weeks, the last 2 weeks, the last week. Every single day is a better day than the day before. But there's a lot of work to do. And so, as the governor mentioned, this is one of our 4 sites across the state. It's state supported, but it's a public-private partnership. It's working together. And, Rebecca Barron is heading the efforts here from Department of Health. We have an incredible team that's here on the ground. We couldn't do it without Major Hopkins and all of his team, and obviously the Safeway team. But we could not do this without our public, and we just really appreciate the patience from our public. As the governor mentioned, We cannot vaccinate 7 million people in this barn today. I'm not sure we can vaccinate even tomorrow 7 million people in this barn. But what we are getting to is what can we do to build the capacity so we can vaccinate more and more Washingtonians every single day. And I think the key message for us is when it's your time, because we know that not everybody is ready in the phasing to be vaccinated today, right? Healthcare workers, those who are above age 65, certainly multi-generational households above age 50. Our message is don't hesitate, vaccinate. That is a key message. We want people to know we're doing everything we can to increase our capacity, standing ready, but ultimately it's going to be up to all of us together to make this successful. So thank you to Washingtonians for your patience. Thank you for your support. We also want to thank our federal partners because, as the governor mentioned, the increase in supply of vaccine ultimately is what's going to help us dive and drive into how do we make this successful. One last thing I would say is that one of our staff members, our incident commanders, Andy Rose, was vaccinated today. He had no problems. He came in, he was vaccinated, and he is now in the 15-minute observation area. And I want to say thank you to him and our entire Department of Health team. And so with that, Governor, thank you for your leadership.
Thank
and
you.
We'll turn it. Yep.
Major Hopkins, you want to share anything? Is there anything you'd like to share? It's up to you.
Just very briefly, one of the reasons that we joined the Washington National Guard as soldiers is to serve our communities. And every one of these guys are citizen soldiers, guys and gals, soldiers and airmen, are citizen soldiers who are currently serving the communities in which they live. So for that, I would like to thank each and every one of them and their families for supporting them. We've been doing this right now approximately 8.5 months between providing swabbing capabilities for the state and now transitioning into vaccination capabilities. So the amount that they've dedicated to this state and trying to help get us through this pandemic is phenomenal. So what I would like to say is thank you to the soldiers and the leadership, not just my Guard leadership, but the state government leadership and the governor, Mr. Inslee, for their support and what they're doing for us and helping us out as Guards.
Thank you, Major.
My name's Major James Hopkins, Hopkins, and I am the COVID vaccination officer in charge.
All right, before I stand for your question, a couple other comments. Major Hopkins has just under 50 members of the Guard doing the vaccinations and quite a number that are doing the logistics. So they prepare the person so we can have them ready to go when it's time for the vaccination. All of those people in the Guard are pivotal. We're so appreciative of what the Guard is doing. I also want to give a shout out to Safeway. Safeway is using their appointment system to vector people into this site, and we have found it's really quite effective. So big shout out to Safeway and all the pharmacies. We now have 1,000 sites.
Safeway.
And we have Safeway here, which I'm going to defer to in just a moment. I do want to make a comment that we are very rapidly expanding our vaccination rate. As I've indicated, we're just to about 40,000 a day. But look, there's a limitation to the number of doses. We got 1.7 million people that are eligible, but we're only getting about 100,000 doses a day. So we're limited by the number of doses we get. And there's going to be a period of waiting that's just mathematically necessary. But I am confident that Washingtonians can get through this. I know something about Washingtonians. We are a strong, resolute lot, and we're going to get through this and get people vaccinated as soon as humanly possible. And I also know this, we can protect ourselves while we're waiting for our turn. We're not helpless in this deal. We can wear masks, we can socially distance, we can avoid getting infected at a Super Bowl party. By the way, here's a comment about the Super Bowl. I hope people are going to be careful during the Super Bowl. Big parties to allow the virus to infect your loved ones at a Super Bowl party, not cool. We are not going to allow the virus to win the Super Bowl, okay? We're going to win the Super Bowl by being careful. And when we do that, we're going to then get our vaccination and we're going to beat this virus. So with that, you guys want to say anything from Safeway's perspective?
Just want to say thank you for the opportunity. We're here to just help the public, and everybody's talked about the partnership. It's really worked well, and we're just glad to be here and be a part of the community. Thank you, Governor, for your support, and everybody else, Department of Public Health, and we're just grateful, and our pharmacists are really happy to be here. One of the comments they say is they're seeing quite a few of their patients that come to our stores, so we're helping the community. That's the main thing, and we want to get everybody a chance to get vaccinated. So thank you very much. Appreciate it.
Thank you, Safeway, and your colleagues.
Thank you.
We have hundreds of pharmacies that are now part of this battle, and we really appreciate the individual pharmacies, large and small. I want to make one other comment too. The vaccine is a miracle. I mean, it really is to have a vaccine within a year. It's just a miracle. But even after we get vaccinated, we need to be careful. We need to continue to wear masks. We need to continue to socially distance, even after we're vaccinated, because we don't have confidence yet that you're not a transmitter even after you've been vaccinated. So we got to stay in this game for some period of time. With that, happy to stand for questions. And any of these folks, I'm sure will take them too.
Governor, I've got to ask you, your Senate Majority Leader from the bill from Spokane is saying that you're poised to make some announcement about changes in the metrics for restrictions you want to produce some news. Tell us about that right now.
Not in this hour, but stay tuned.
Later today?
Stay tuned.
In terms of making appointments, I know there has been at least one people about when will be a set time. Do you have any idea if there is going to be like kind of a window where people can make appointments each week, or kind of how that would go?
I'm going to ask Rebecca and my friends from Safeway to answer that. Rebecca and Safeway, could you help us answer that question?
Sure. So we're currently working on the registration link, at least for this site, for next week. It's dependent upon how much vaccine, what our allocation is. Once we set those appointments, once we have the allocation, we can begin to set the appointments, and we'll be working with our public information office to ensure that the link is sent out at the right time so that everyone is aware of it. We're also trying to identify a way where a portion of those appointments could be booked through 211 or through a phone system, because there have been a number of folks who've come to the pod who've been unable to make an appointment because they lack internet access. So we are working through some of those issues. It's been just trying to work through them.
It's impossible at this point to book online for next week right now.
Correct.
Is that going to change only once you know the allotment, or is that something you can allow some people to sign up going into the future without knowing?
We're hopeful that moving forward that we'll have more of like a 3-week projection of our allotments, which means we'd be able to open up 3 weeks ahead with appointment slots once we have those allotments and the vaccine allocation in place.
Let me jump in here and just say, and let's try to be a little distance here. Thank you, including all of you. So we want to make sure you guys are as well. The thing is that, as the governor mentioned, right now from our federal partners, we're receiving a week to week to week. So we're just finding out the week before when the allotment for the following week is, how much it is. So we've now been told by the federal government that they're working towards a 3-way runway, if you will, that gives us better projections on what's coming. Now, once we get that into motion, then we can look at all the appointment pieces, which then allows us to look at registration and what that does at any of our 4 sites. So it's not going to be immediate, because we have to first get all the information and the assurance that it's happening. Once we have a better feel for what is going to be happening a few weeks out, obviously our goal is to try to make it as easy for Washingtonians to register and sign up.
Let me one more question.
I would like to ask you about see a little change in the way we're dealing with Oregonians, at least yesterday. Now it sounds like IDs could be required at least. Can you talk about that and how big a problem it is with Oregonians coming in with trying to get vaccinated? Do you think it has to do with the fact that there's all these CDC guidelines and Governor Brown's not like when he teaches in front of the elderly?
I think we're going to be just fine. I'm confident that Oregonians are going to stick in Oregon. They can root for the Ducks, and they can get their vaccinations in Oregon. We will root for the Cougars and the Huskies, and we will get ours in Washington. I don't think this is going to be a big problem. We did send a message to our friends in Oregon that we want them to do their vaccination work in Oregon. I'm confident that that's going to work. So I really don't think this is going to be a problem now that we've made clear what the policy is. Thank you very much. Please take care of your health. Take care.
Thank you. Appreciate it.
Rebecca, thank you. Thanks for your work.
Okay.